Thank you again for joining us to another vaccine forum. So let's begin with the technology behind this messenger RNA vaccine. So on this graph, you can see a comparison of the four main vaccines that are currently undergoing phase 3 trials. The Moderna and the Pfizer BioNtech vaccines are in the middle. Those are the messenger RNA vaccines. We started with the Pfizer BioNtech last week, and this week we're giving the Moderna vaccines. Both vaccines require 2 doses. The Moderna is day 1 and day 29, so it's 28 days apart. The Pfizer BioNtech is 21 days apart. And both vaccines are 95% effective in preventing the disease. And the storage requirements are slightly different. The Pfizer BioNtech requires minus 70 degrees Celsius, so that's ultra cold storage requirement, while the Moderna requires just minus 20 degrees, which is your typical freezer temperatures. The other 2 vaccines you see there are not RNA, they're what are called viral vector vaccines. Oxford University AstraZeneca and the Gamaleya Sputnik 5, which is from Russia. So both of those also require 2 doses, but require regular fridge temperature storage, and their efficacy varies between 60 and 90%. So let's look at how this vaccine works. If you look at the human figure on the left, that's receiving the vaccine, the injection, you can see the RNA is a single strand, it's a helix, and it's a spiral, but it's single strand. And what this messenger RNA carries is the code to make a specific protein. And you can see once it's injected in the muscle in the shoulder, the cells in our body take this messenger RNA and then translate that code and make that spike protein. You can see there, those yellow golden spike proteins. Once those proteins are made, the immune system of the body immediately recognizes those spike proteins as alien and builds antibodies, those red Y-shaped antibodies in that second human figure. Once those antibodies are made, now this person is immune to the disease. So if they encounter COVID-19 virus in nature, these antibodies immediately block and neutralize completely the virus. So the virus is unable to cause disease, infect cells, enter cells. It's completely neutralized. So we will start by looking at the data for safety and efficacy of the first vaccine that was authorized for use by FDA. It's the vaccine made by Pfizer BioNtech. Their name for this virus is Comirnaty tocilizumab. That's the name of the vaccine. So let's look at this trial. Pfizer BioNTech's vaccine underwent 3 phases. The first phase to show it's safe, and it successfully passed that. Then it went on to what are called medium-sized phase 2 trials, where it looked for safety, efficiency, and the dosage needed. And then they settled on a 30 microgram dose. So phase 3, they enrolled 44,000 trial participants, half of whom received the vaccine and half received a saline shot. So that's how they divided up the groups and then looked for how effective was it in preventing the vaccine. So the groups that made up these trial participants, half were female and half male. 82% were white people, 10% African American people, 4.4% Asian people, and less than 3% other racial peoples. So 26% of all participants were Hispanic, Latino, Latina, and 21% of participants were greater than 65 years of age. So that's a very important group, that 65 and above group. So there were enough participants in this trial, 21.4%, to make it a good trial. And the median age was 51 years for the Pfizer BioNTech vaccine. So most frequently reported comorbidities were obesity. In that trial, participants, 35% had obesity, 8% had diabetes, and 7.8% had pulmonary disease. So the researchers made sure to include these important comorbidities in order to make sure that the results can be generalized to the population. And if you look at the geography, most trial participants were in the United States, 77%. 15% were in Argentina, 6% Brazil, 2% South Africa. So the reason most were in the US that's where the outbreak was dominant. The virus was very prevalent in the community, so it's a perfect setting for this research to occur, because once you give the vaccine, you want to see if the participants get the disease. So what were the common adverse reactions? The most common was 84% of those who reported some adverse event had injection site reactions. What I want to clarify is less than 10% of the trial participants of 44,000 people actually had adverse reactions. Of that small group of 10% who reported adverse reactions, 84% of that small group had like pain, swelling in the local site at the shoulder muscle. Fatigue, 63%, headache, 55%, muscle pain, 38%, chills, 32%, and then joint pain and fever, a smaller percentage of 23 and 14. So clearly, all of these symptoms and adverse reactions are minor. They don't last more than a day or two. Usually they go away in a few days. And the best part is that none of these adverse events needed hospitalization or any medication other than some minor over-the-counter type medications like Tylenol. So what it means is these adverse reactions, even though they occur at some frequency, first, they only occur in less than 10% of recipients, and they're minor, they don't last long, and they're tolerable. The benefits of the vaccine far outweigh any of these minor adverse reactions. The one set of adverse reactions we're most concerned is the severe, what are called severe adverse reactions, and we'll go into that in detail, but they only made up 0.5% of that 10% of folks that reported any reaction to the vaccine. So let's look at those severe adverse events. The most common in those that received the vaccine, there were a few cases of appendicitis. They accounted for 0.04% of all the participants. Heart attack, 0.02%, and then stroke, 0.02%. And in those that were in the placebo arm, in other words, they got a saline injection, not the vaccine, they had pneumonia, atrial fibrillation, which is a kind of rhythm abnormality of the heart, but that's also 0.02%, and then syncope, which is fainting, 0.02%. 12 participants had appendicitis, 8 in the vaccine group, and 4 were not in the vaccine group, so in the placebo group. So of the 8 cases, 6 in the younger age group, 16 to 55, as would be expected, and then 2 occurred in the older age group, greater than 55. And then one of the participants had an abscess, one had a perforation, but all of these cases were reviewed thoroughly by the independent board and by the researchers in detail, and all of them were expected. These are not because of the vaccine. These were kind of the same frequency that you would expect to occur in the general population. And let's look at deaths that occurred during the trial. A total of 6 deaths occurred in the reporting period, and 2 occurred in the vaccine group and 4 in the placebo group. So in the vaccine group, one of the participants had obesity and atherosclerosis, which is a disease of the blood vessels, and they died 3 days after dose 1. The other participants had cardiac arrest 60 days after dose 2 and died 3 days later. Again, both these deaths that occurred in the vaccine group were not related directly to the vaccine. These are unfortunate occurrences because the participants had pre-existing comorbidities. If you look at the placebo arm, the one that the trial participants received just the saline shot, there were 4 deaths. 2 of them unknown cause. 1 died from a stroke and 1 died from a heart attack. So these were participants who did not get the vaccine, just got a saline shot. So, and then 3 of these occurred in older age group, greater than 55 years. So all of these deaths, they represent events that you would expect to occur in the general population in those age groups at a similar rate. These were not directly related to the vaccine itself. So if you were to compare adverse reactions, this is a good table. If you look at the columns, there are 4 comparisons there. Shingrix, which is a shingles vaccine, Then there's Pfizer COVID BioNtech vaccine that we gave last week to about roughly 975 folks here. And then Flucelvax, which is for the flu vaccine. And finally, placebo, which is just salt water injected into the muscle. So all of these vaccines, you can clearly see across the board, all of them, when you give something like that, something that creates an immune reaction and response from the immune system, you have some local pain, redness, swelling, muscle aches, fatigue, headaches, chills, fever, and some GI or gastrointestinal symptoms like some vomiting, some mild diarrhea. All of them are not permanent. They're very transient. They last less than a couple of days, usually 1 day or 2, and then they go away without any lasting effects. And the best part is you can see in the saline group that received just the saltwater injection, they also had reported some of these very same symptoms. What this means is this is not unexpected, number one, and number two, it also indicates the vaccine is creating an immune response. That's why you get those local reactions. But none of these reactions are harmful in the long run, and more importantly, the benefits of getting the COVID vaccine far outweigh these minor inconveniences. Unfortunately, these are distressing to the person experiencing these symptoms, and some experience them to a greater extent than others. But none of them require hospitalizations, none of them require medications other than over-the-counter. If we were to do a subgroup analysis of those that had some morbidity like cancers, heart disease, COPD, which is a lung disease, diabetes, hypertension, you can clearly see in this subgroup analysis of those who had these kind of pre-existing conditions, they still did very well with the vaccine. So the vaccine protected them anywhere from 94 to 95% of the time. In other words, 95% of the people with these kind of conditions did not get the disease because the vaccine immunized and protected them. The 5% that got the disease, all of them got very mild forms of the disease. So in other words, this vaccine is 100% effective in preventing any severe form of the disease. So the 5% that do end up getting the disease despite having the vaccine get a very, very mild form of the disease, so they are protected as well, and they don't suffer any consequences, either short-term or long-term. This is a great graph. This clearly shows how effective this vaccine is. If you look at it and follow me on this, there are two lines there, the blue line and the red line. And so the blue line is those that received the vaccine, and the red line is those that got the saline injection. So if you look at the x-axis, which is the horizontal axis, there are numbers there, 0, 7, 14, 21. So those are days, all with the frequencies of 7-day intervals. So you can clearly see at day 0 through day 10, both the blue and red lines are parallel. In other words, these folks, trial participants in both the vaccine group and in the saline group, were in a setting where there was COVID in the community, and so they were getting the disease. That's what this incidence means. Incidence or occurrence of the disease was the same in both groups. But once you get to day 10 onwards, you can clearly see that the red arm, those that just got the saline shot were no longer protected because they didn't get the vaccine. And then after day 10, they continue to report instances of the disease, while the blue arm, you can see clearly after day 10 through the second dose on day 21 and onwards, they had no further incidences of disease. So they were completely protected by the vaccine, while those that were in the saline arm, who were the placebo group, continue to suffer the disease. So finally, just a summary, the Pfizer-BioNTech vaccine, very effective, 95% effective, and astonishingly in the small group of people greater than 55 years and older, it is 94% effective. So clearly this works in all age groups, and very importantly in that 55 and above vulnerable age group as well. And so this is efficient and safe vaccine, and we gave it last week to roughly about 975 people here, and none of them reported anything but minor symptoms that resolved without any medical intervention. Let's look at the second vaccine that the FDA gave emergency use authorization, called Moderna's mRNA 1273. So their trial was also phase 3, so they successfully went through safety in phase 1 successfully. Then phase 2 looked at a small group for dosage purposes and safety and efficiency. They passed that as well. And then phase 3, a large group again, 30,420 people were enrolled. Half of them were in the placebo group and half were given the injection. This one is 100 microgram compared to the 30 microgram in the Pfizer BioNtech vaccine. The mRNA vaccine by Moderna is given at day 1 and day 29, so 28 days apart, and it gives them, again, great protection and very safe as well. Let's look at the demographics. So the trial participants of the large group here, half were male, half female. 36% were representing communities of color, and of that, 10% was African American people and 4.7% Asian people. Less than 3% from other racial peoples. 20% again of the participants were Hispanic, Latino, Latina, which is very good. And then 25% were greater than 65 years, a very solid representation of that vulnerable greater than 65 age group. So 1/4 of the participants were at least older than 65. So let's look at adverse reactions. Again, they're very good here. 91% reported some sort of pain at the injection site, not unexpectedly. Fatigue, headache were about 68 to 63%. And then muscle pain was about 60% and 44% joint pain, chills 43%. Again, all of these adverse reactions occurred in a small group of the large group. Only 10% actually reported any form of adverse reactions. Of that small 10%, you're seeing the breakdown here. Now, the one group that we are always looking for is the severe adverse reactions, and that was 0.2% for the Moderna vaccine. So what were those severe adverse events? So let's start with the vaccine group. In the vaccine group, myocardial infarction or heart attacks, 5 cases were reported versus only 3 cases in the placebo group or the group that got the saline shot. And then cholecystitis, which is an inflammation of the gallbladder, 3 cases in the vaccine group, no cases in the placebo group. Nephrolithiasis, which is kidney stones, 3 cases in the vaccine group, 0 cases in the placebo group. And then remember that these are very small numbers, so there's no causal relationship. In other words, the vaccine did not cause these things. These are what you would expect in these age groups at those frequencies. Now, if we looked at the placebo arm, those that received the saline injection, pneumonia was reported in 0.05%, and pulmonary embolism, which is a blood clot in the lung, was reported in 0.03%. Again, these were what you would expect. These were not because they received the saline injection. So let's look at deaths. 13 deaths were reported. 6 were reported in the vaccine arm, and 7 were received in the placebo arm, or the one that got the saline injections or saltwater injections. So 2 deaths in the vaccine group were older than 75 with pre-existing cardiac disease. 1 participant died of cardiopulmonary arrest 21 days after dose 1, and 1 participant died of heart attack 45 days after dose 2. And a 70-year-old with cardiac disease was found deceased 57 days after dose 2. And a 56-year-old with hypertension, chronic back pain, being treated with opioid pain medications died 37 days after dose 1. And the official cause of death was head trauma. And a 72-year-old vaccine recipient with Crohn's disease, short bowel syndrome, was hospitalized for low platelets, acute kidney failure, obstructive kidney stones, and 40 days after dose 2 developed complications and resulting in multi-organ failure and death. 1 vaccine recipient died of suicide 21 days after the dose 1. And then in the placebo group, those that received these saline injections, 3 died from heart attack, 1 died of abdominal perforation, and then 1 died of a cancer and with complications, and then 1 died of COVID-19, the disease, and then one case of death in the placebo group was unknown cause of death. Again, all of these deaths represent events and rates that occur in the general population of the individuals and is not in any way related to the vaccine itself. And this was carefully, thoroughly reviewed both by the researchers and by the independent board of experts. Again, incidence curves are great ways to look at how good this Moderna vaccine is. You can see the red line in this case are those that received the vaccine, and the blue line is those who received the saline injection. And again, after day 14 or so, you can clearly see the difference. And then again, after day 29, when the second dose of the vaccine was given, you can see no more incidences of the disease. But in the blue arm, where they just received the saline injection, they were not protected, and they continued to suffer from the COVID-19 disease occurring in that group. Again, subgroup. If you looked at chronic lung disease, heart disease, obesity, diabetes, liver disease, HIV, all of those groups, when you looked at carefully, again, the vaccine was 100% to 95% effective in protecting them from getting the disease. So almost very few people got the disease, and the 5% that did end up getting the disease despite getting the vaccine were also protected because they ended up getting what is called a very mild form of disease, not requiring hospitalization, requiring no effort other than just some mild symptoms that resolved, and they never had any long-lasting effects from the disease. So it clearly protects against severe disease, even in those that did not, those that got the disease. And let's look at efficacy. If you summarize it, it is very effective in all participants, and especially again in the 65 and older, the Moderna vaccine is 100% effective in preventing COVID-19 disease. And I want to give a small summary of the DART findings. So the DART stands for Developmental and Reproductive Toxicity Studies. So these trials cannot be done in humans for ethical reasons. So this is done in animal models, here female rats. And what they did was gave the same 100 microgram dose of the Moderna vaccine prior to mating and during gestation, so during pregnancy. And then they found there was no effect on female reproduction or on the fetus or in the embryo during development, and also after delivery. And there were no developmental effects noted. So these are very reassuring findings and kind of support the use of this vaccine, the benefits of using this vaccine in those that are pregnant. So let's go through some frequently asked questions. So is it okay in pregnancy, and is it okay for moms who are breastfeeding? The answer is yes. This vaccine's benefits outweigh the risks. Of course, it is a shared decision-making between the person who's pregnant and the physician or the provider. Very important to note here that we don't have human trials, but we do have animal trials, and more importantly, we know for a fact that when pregnant persons get COVID-19 disease, unfortunately, they suffer severe forms of it. So it's important that they get the vaccine. And as far as taking this vaccine, let's say you're taking a flu vaccine or another vaccine, it's best to have 14 days space between the two vaccines. This is not based on any studies because it's a new vaccine, but that's general recommendations. So in case you forget or you get a vaccine even without knowing it, within that 14-day interval, it's all right, but ideally 14 days gap. And then if you received convalescent plasma for COVID-19 disease or monoclonal antibody treatments, which is that infusion that we give here, the cocktail antibody cocktails that people talk about, that kind of medication, you want a 90-day interval before you get this vaccine. That's again a general recommendation. If you don't and you accidentally were to get the vaccine, that's okay. And then as far as if you already had COVID-19, it's perfectly okay to get this vaccine. Important thing to understand here is this vaccine protects you specifically in neutralizing and creating neutralizing antibodies. So everyone who gets this infection, we're not sure how effective their immune response is. Some people have a very robust immune response, and some have a mild response. And you could get reinfections with COVID-19. We're beginning to just find out. So this vaccine will protect you from getting reinfections or an infection that is severe. So that's important. So you can take this even if you had the disease before. Now, if you want to wait 90 days, because that's how long it takes for someone to get reinfection, that's okay. Because their supplies are restricted, it might help others to get in line. But no harm. In fact, there's full benefits to getting this vaccine, even if you previously had the disease. Now, two other points. If you are in the outpatient setting or actively having this disease, please wait until the quarantine period has ended, so 14 days from the start of your symptoms before you get the vaccine, because you don't want to expose the healthcare personnel and other people waiting in line on that day when you go to get your vaccine. So that's a simple, basic public health measure. So if you've got the disease, wait for the quarantine period to end before you go get your vaccine. That recommendation is different if you're a resident of a skilled nursing facility. If you have the active disease, you can get the vaccine right then and there. You don't have to wait that 14 days, because there in that setting, you're being taken care of folks that are well protected, wearing PPE, wearing masks, gowns, and doing all the right things. And finally, no need to test for this disease before you get your vaccine. So don't worry. You can take the vaccine if you had the disease. If you're not sure if you have the disease, you don't need to do any testing. Okay, allergies. A lot of questions here. So I'll summarize in one sentence would be, you can get this vaccine despite having allergies to anything before. So let's talk about severe allergic reactions. And to put that into context, remember that we have been giving billions of vaccines worldwide since the 1950s, when vaccines became a public health measure that has saved lives, helped children grow up without being maimed by horrible diseases and live out their full potential. And all that time, these billions of recipients of vaccines, the severe reactions to no matter what kind of vaccine is less than 1 in a million. So less than 1 in a million recipients suffer what's called a severe allergic reaction. So something that we call a reaction that requires your hospitalization or any kind of medical intervention, even if it is only for an hour or two, when you receive things like epinephrine and Benadryl and things like that. But a severe reaction is rare, number one, because it's less than 1 in a million. Number two, even those folks, the benefits of getting this vaccine outweigh that risk. And we usually observe, not usually, but we always observe all of our folks for at least 15 minutes, if not to 30 minutes. Now, the only time you don't want to get a second dose of this vaccine is if during the first dose you got a severe allergic reaction. And this is very rare. Again, just getting a mild allergic reaction like swelling, hives, itching that go away with Benadryl and last less than a few hours, even for mild reactions, there is no reason not to get the second dose. Having said that, if you're having allergic reactions in the past to foods, to pets, to environmental allergens and latex or oral medications, all of those are okay for you to still get this vaccine. This vaccine is okay, doesn't cross-react with those kind of allergies. You're totally safe to get it. We always watch you for 15 to 30 minutes after you get this. One other thing I would note is most severe, in fact not most, all severe allergic reactions occur within the first 10 to 15 seconds of getting this vaccine or any other vaccine. And that's very rare, again, 1 in a million, less than 1 in a million. So important thing to remember here is when you get your vaccine, we'll observe you. If you pass that 15 to 30 minute wait time and you have nothing more than mild symptoms of whatever, local pain, and the next few days you might have some headaches, some mild muscle aches and some chills, and some people suffer a little bit more and they're more distressed by those, and it is still worth it to undergo some of those mild but distressing symptoms in order to protect yourself from COVID-19. And in a way, by doing so, you're also protecting the community, because we would like for the community to get at least 75% of our community at minimum, 75% to 80% vaccinated. So then we protect those that cannot get the vaccine, like some immunocompromised folks, some much older folks, and some younger folks as well. And so this is very important that we all get this vaccine. How about testing? Once you get vaccinated, is the test still good? So in other words, if someone got a vaccination, will the tests be false for this COVID-19? The answer is no. The tests are still effective. They are not affected. So the PCR test, which is the nasal swab that they get the sample from the back of your nose, and the antigen test, which is the rapid test, those tests are not affected at all. The only tests that, these are more for academic purposes, is the blood test. You only do the blood test to look for antibodies, not to say if you've got the disease. So that test is affected, but only one specific type of antibody test, the antibody test to the spike protein. But the antibody test to the N protein or nucleocapsid protein is not affected. So those blood tests are usually done in the research setting. So if someone wanted to check to see if you, after you had the vaccine, developed antibodies, we can tell the difference. There's a specific antibody test that tells us that the antibodies you created are because of the vaccine and not because of a disease you had in the past. But remember again, the takeaway is the normal tests for testing for the disease, the nasal swab and the rapid test, are not affected even if you got the vaccine. Okay, we'll go to an exciting slide. This is something that's caused a lot of buzz and stir and anxiety in the public. The so-called mutation of this virus causing a lot of alarm in the United Kingdom. The map is on the left. You can see the United Kingdom map showing the distribution of the disease, and that if you look at the southeast portion of the map, there's a dark purple area. That's where this variant was found. So it's a variant of the same virus that started in Wuhan, China, that caused COVID-19. So it's the exact same virus, but there's a variation. There are a few mutations that occurred, and none of these are significant enough to affect our vaccine, but I'll explain that in a minute. The second picture to the right of the map is showing the entire genomic sequence of the virus. And this is the mutated virus, and you can see there are a couple of X's there in red. There are about 7 changes in the spike protein and a few deletions and a few other changes, in all totaling about 20. But none of this has changed the transmission of this virus. None of this has changed this virus to cause a more severe disease. In fact, it's pretty much the same disease. And also, this mutation does not make this virus escape detection by the tests we do, and more importantly, the vaccine is not affected. Okay, we'll explain that in this illustration here. On the right-hand side, you see an illustration of an electron micrograph picture of the spike protein. It's a very complex protein. This is what, if you remember the picture of the virus, it's a sphere, like a ball, with lots of spikes on it. And those spikes are what give it the name coronavirus, because it looks like the solar corona. But those spikes are how this virus attaches to the cell, enters the cell, infects the cell. Without its ability to use its spike to attach and infect cells, it cannot cause disease. So you can see on this picture, there are several spots that are named. There's RBD, which is the receptor binding domain, the N-terminal domain. There are several domains. All of these domains are multiple areas. The vaccines in all these trials, the Pfizer BioNtech, the Moderna, the Oxford AstraZeneca, the Johnson & Johnson, all of them achieved their protection by training our immune system when we get the vaccine to recognize many different sites. So even though there were 7 mutations in the spike domain of this virus, the variant cannot escape this vaccine, because this vaccine attaches on, the way it creates this antibody, it attaches on to all of these various domains. So it's a very clever design, and scientifically a very, very robust design that does not allow this vaccine to fail. And the experts believe that this mutation, this variant, will not interfere with the vaccine. The vaccine will still be successful. Currently, both Moderna and Pfizer BioNtech are doing research on this. What they're doing is taking all of their vaccine recipients in the trial, taking their blood, because their blood now has antibodies that they're vaccine generated, and they take these blood samples with the antibodies generated by the vaccine and test it against a live virus. And the preliminary report is the vaccine antibodies clearly neutralize the SARS-CoV-2 virus, the virus that causes COVID-19. The final results will be available in 2 weeks' time, but so far the experts are encouraged by the early findings, and we will know in 2 weeks the final results. But the good news is everything is indicating that this vaccine is effective and this viral mutation cannot escape it. Just a quick picture to show that this vaccine has one other weapon up its sleeve. Not only does it produce antibodies, it produces what are called killer T cells. And so there's a T cell response which is different from the antibodies that our body produces. And between these two, the virus, even with the mutations it has, cannot escape it. So in summary, the mutation, the variant that we're talking about, the mutant variant virus of SARS-CoV-2 that they found in Britain, in the UK, the United Kingdom, it's called B.1.1.7, 23 mutations. It is not a new supervirus. Remember that. That's the one thing you want to take away. And according to what we already know, it does not change the transmission, how it spreads, what kind of disease it causes. It's pretty much the same virus causing the same disease. So the consensus is this will not have any effect on the vaccines, and we should be able to stop this virus using masks, hand washing, and the normal measures. And this is a map showing that the Pfizer-BioNTech vaccine has received approval or emergency use authorization in several countries, Canada, the United States, and North America, several countries in South America, Chile, Panama, Colombia, Ecuador, Costa Rica, several countries in Britain, and all of the European Union countries. That's the entire Western Europe. And then you can see in the Middle East, Kuwait, Bahrain, UAE, Saudi Arabia, and then in Singapore in the Far East. So all of these nations, and today a few others have joined as well. So this is encouraging because all these researchers, independent researchers and world experts, global experts on immunization, vaccinologists, virologists, all agree that this is not only safe, but it's also a very effective vaccine to stop this disease.